This video will cover acquired cystic disease-associated RCC in addition to low-grade oncocytic tumor. Let's anchor ourselves to the first tumor. Our character blowing bubbles represents cystic disease, and the fact that he's in the middle of dialysis represents the fact that these tumors arise only in end-stage renal disease patients. Despite all this, the character and his provider look happy and look like they're doing well. This represents the fact that these tumors are generally indolent. There are a couple of findings for us to remember about it. The first one is that it commonly has a microcribiform appearance, which is conveniently represented by this microcrib toy that our character has next to him. The next thing to remember is calcium oxalate crystals, which are also commonly seen on H&E. This, of course, is represented by our ox character. Moving on to low-grade oncocytic tumor. This tumor is separated by this room divider so that we can keep both of these straight in our heads. The way we'll remember oncocytic is, of course, by the pink color of the bongo drums. But there's more. Doesn't bongo sound like onco in oncocytic? And the fact that these drums are some type of low-grade, inexpensive drums, we can put it all together to remember low-grade oncocytic tumor. One more helpful thing to remember with these drums is that they have a round surface, don't they? Well, these tumors tend to have round nuclei. The thing to remember about this one is that it has a solid architecture, which is represented by the architect's compass on top of a solid stone. Next, as per usual, the caret represents keratin positivity on IHC, but more specifically, CK7. Also, let's note that there is a halo on top of this caret. The halo will help us remember that the tumor cells characteristically demonstrate perinuclear halos. Additionally, the halo might help us remember CK7, since the number 7 sounds like heaven, right?